Good afternoon, and today we have a pleasure to interview Dr. Samantha Slotnick. She is behavioral optometrist. And yes, our channel devoted to problem with the sleep and breathing. And you probably wonder why I brought behavioral optometrist to the channel. But what I noticed over many years working with patients who have a trouble sleep and breathe in the same time, I notice also they usually complain on the neck pain, back pain, problem with the jaw joints. Very often, I just see that domino effect, which affect the hip, the knees, and the gait, and sometimes it can be the balance issue. I was always wondering why. I asked a lot of my mentors about that, but it was a wonderful meeting when I came to Dr. Laura Tarada office and I saw team working together. It was dentist who specialized uh, in a sleep disorder, addressing sleep disorder breathing, and postural physical therapist, and behavioral optometrist, Dr. Zlotnik. And I thought, oh my God, that's probably the way it's integrative approach to any problems. And that's why I'm going to bring this in a series of interviews. I'm going to bring this team on our channel. So, good afternoon, Samantha.
Good afternoon, Maria. Thank you for inviting me. I'm so happy to be able to meet your audience and maybe to open up the eyes a little bit about what else is affecting how we hold ourselves, certainly while we're awake, but that this carries on into sleeping as well.
Absolutely. And again, we appreciate our audience. And if you want to ask Dr. Zlotnik the questions, please put them in the chat box and we will find you an answer. And a little bio about Samantha. She has a private practice in Scardale, New York, providing a whole person holistic approach to vision care for all ages. In recent years, her work has extended to address reciprocal relationship between body organization and visual spatial processing. All this sound complicated, but we'll find out some details shortly. The lens-based postural therapy uh, has become a key to Samantha collaborations with colleagues involved in body organizations such as a physical therapist, craniosacral therapist, osteopath, chiropractors, myofunctional therapists, and other specialties involved in postural restorations. In postural restorations, a lot of dentists like myself, they work with the specialists like that a lot.
Mhm.
So my first question to you, and it was all this information, I was also very new to that, and Samantha was very nice to educate me about that, and I want to bring it to my audience. My first question to Samantha, how does our vision actually affect our posture?
That is an excellent question, Dr. Sokolina. The interesting thing is that as a vision specialist, I may use the word vision to mean something slightly different than what the layperson uses the word vision for. In the same way that if I say bite, I may think of something very basic, like how I would put my mouth into an apple. But for a dental specialist, to say bite means a whole bunch of other things. So when we talk about vision, most people are referring to having, for example, perfect vision. They think, what is it to have perfect vision? I have 20/20 visual acuity. I have perfect vision. Well, that term 20/20 is actually a measure of what's called visual acuity, which is about what is the least you can see. So, for example, if I take the letter C and I make it really, really small, how small can I make it while you can still tell that it's a C and not an O? So that's about how little you can see. So most people, when they think they have perfect vision, they're talking about the minimum they can see. When we use the word vision and we think about visual processing, when especially in behavioral optometry, we're thinking about how much you can see. That's how much do we use our peripheral awareness, our sense of space. So when you ask, how does vision affect posture? Well, how a person gathers visual information affects how they hold their head upright, If they are very, very centered on something, they may drive themselves to get closer to the material. They may start affecting a forward head posture because the eyes are leading all of their interests. So a person who's really a reader, they may tend to lean in and they start getting neck problems. They may develop a back hump as well as they are getting older because they lean in so much. They may also, with that, become more nearsighted. So the way that they use their eyes, the area of space they pay attention to, all of that becomes the area they center around, and that affects their posture while they're sitting. It affects their posture while they are upright as well. Sometimes it carries over. So
Yeah,
hopefully,
that's very interesting because most of my patients have a forward head posture. Most of
oh,
them, yes. And I see, how it affects the gait as well. And a lot of
mm-hmm,
patients have a trouble with the feet. They
mm-hmm,
have, they cannot walk long distance. They have a pain in the feet. Sometimes
mm.
inflammation of sesamoid bones, I think, towards the front of the feet, stepping towards the front of the feet. So please tell me, how is lens-based postural therapy work?
So, lens based postural therapy is a term that I have started to use to better describe how I've been using lenses to collaborate with other therapists as well, like physical therapists. Also, I've been doing this independently for many, many years beforehand, where I will ask a patient who maybe I get to a prescription. Now take a walk down the hallway. Let me watch you. Let me see how you move. And I just watch to see, how do they hold themselves? How do they move in space? How do they use vision to direct their action? And then I've come to realize that sometimes, for example, if they have a head tilt, I can put on a lens that helps them feel like the visual problem that makes the head want to tilt is more neutralized, and then they hold their head more level. When they hold their head more level, they are using the eyes better as a team, because our eyes are actually designed to partner up best when the head is right, when the head is
That's
level,
amazing.
right? So then they start to use visual information from the left and right sides more symmetrically in an integrated way. We actually will see things like a person walks in a way that it's almost like one leg is guiding them and the other leg is like a cane, where they take a step with one foot and then they're just supporting themselves to take the next step. So they're not really using the two sides of the body in a reciprocal way, where each leg holds balance for a period of time. They may be more leaning over or even centering their head more over one side of the body than the other. A lot of times it's because of how they are using or even misusing their vision. When I find a lens that helps them use the visual spatial awareness more open and symmetrically, both sides of the body get more involved, and it carries all the way down where they feel themselves let go of tension. They free up the movement of the entire chains, going from the head down through the neck, through the torso, and right on through the legs into the feet. And they may feel the ground differently. We can change the vision and help them stand more upright if they tend to lean over too much, by helping them to feel that the world is more level instead of walking downhill. These are things that when we help them come to balance with their environment using lens-based postural therapy, the lenses are working in a sensory way. It's automatic. The
Yeah,
lenses just allow them to be more available and free and moving more comfortably. So this has become a really wonderful tool that's helping me actually not just help the patients, but it's helping the patients get help from other providers too. So, for example, I have a patient who she has severe scoliosis. And when she is using the lenses that I provided that help her stay more upright and help her move on both legs, she says that her when she wears them for Pilates class, her Pilates instructor said, "You have far more strength in your body when you wear the lenses." So instead of taking them off so that she is unencumbered, she's actually learning that she's able to support herself better. My lenses that I'm wearing have the same kind of an effect. And when I wear them for yoga, I can bend further. So there's some very interesting side effects of the body, even if the eyes are closed, some of these side effects can take place where a person can be more relaxed. And that seems improbable to me, but I keep seeing that it works anyway. So,
No,
you
this is amazing. This is a fascinating fact, and I'm learning that from you. And I hope some people in our audience can find that useful for themselves. So I would like to ask you how, I saw you working as a team with a holistic dentist, postural physical therapist, and you. And if you can give an example, how do you work together? And I really like how you talk about eyes being so close to the bite and close to the base of the skull.
Well, I think the thing that when I started collaborating with these people is realizing, first of all, that you don't have separate eyes and teeth and separate head and body, that we actually are integrated beings, and it's one brain that's holding our whole being together. And people tend to have personalities that are pretty consistent through their lives, and patterns that they take on that affect how they engage with things. So, for example, if you are very focused on things, you may center on something, you may really bite into it, and you may actually use different parts of your mouth depending on your attention or where you want to chew on something. But that's also how you may carry your whole body posture. You can see, even talking about it, I'll maybe curl my shoulders or curl forward. And the understanding is that these create patterns in the head, they create patterns in the body, and that the bones of the cranium are actually all interconnected. I mean, this is one big puzzle piece where, like you said, the roof of the mouth is essentially the same bones there are going to be about by the floor of the eyes. The bone that has very little real estate on the outside of the cranium, which is called the sphenoid, has a ton of real estate right in the middle, and any skews of that bone is going to interfere with a bite. But it can also skew so that the eyes and the shape and the space available for the eyes in the sockets is not equal on the two sides, or maybe that it's a little tweaked one way or the other, or there's a tendency for a head tilt that comes along with that. Sometimes it's because of these problems where if you lose teeth, you lose contact. You lose your security, you lose your foundation, and then you start to lose that sense of which way is up. How do I keep my head up? That carries through the whole body, including the entire, like I said, the torso, how you balance with the pelvis. So we have all of these different floors of our body, and this integrative approach, postural restoration, is one of these approaches where people of all different specialties in posture take this integrated, holistic view of how each of our fields make sense of how a person processes space in their own body, and the visual role is space out in the world. So this sense of space that a person has in the world and their environment is actually affecting how they feel in their own center.
This is also fascinating, and I'm sure it's a lot of new information, and for me as well. And I would like to ask you about some specific cases. How you were able to address the posture and maybe back pain with the different lenses.
Yeah. So, for example, one of the patients that I work with is a young man. He's only 93 years old, and he doesn't want to depend on any implements. He keeps himself active and young, and he came to me wanting to maximize his vision. So what I actually have been working with him on and off over probably 15 years now. So we've become old friends. But it took a very long time for him to be willing to wear the lenses that I prescribed in this idea of helping him keep himself more upright, because he had developed a tendency to stoop over, and that creates a more of a hump to the back. And he had also developed tendency where one eye is doing more work than the other. So he wanted to make one eye stronger. And I kept telling him it's not about using one eye and making that eye stronger. It's about partnering the two eyes together. And that helps to get him more level. So, for example, this patient who's allowed us to share a video if you're able to share it, but if he takes his head and tilts it, as is normal, when he puts the glasses on, immediately his response to the vision is that it makes his head want to level, like it orients his sense of what is up and down in the world. It immediately helps him bring his head up above the torso. It helps him start letting go of some of this curvature in his back and the head tilt that he's been accustomed to having. When he picked up his head and then takes a walk in the lenses, he also realizes that he's meeting the floor more centrally on his feet instead of over on his toes, because his body center and his mass is now above his pelvis instead of being in front of the pelvis. So this kind of a case is a person who I haven't actually worked with him as part of the team. It's just been starting with the lens-based therapy and helping him become more aware of space and the role that having the lenses on plays, not in helping see less or more clearly, but helping him feel better in his body. So he's trying to use them as a tool where he can learn how to posture differently, and they are sort of like training wheels for him. And
Excellent.
that way, yes, he feels like he doesn't feel like he's created a dependency so much as the lenses are allowing him to do something that he wasn't as comfortable doing, but he's actually getting better at being less dependent.
Yeah, no, that's very interesting. I would like to ask you some practical tips for good vision and good posture in the same time. What would you recommend to our audience?
Well, I think one of the things to realize is that when we use our vision, a lot of the times we think about what we look for, and we don't always think so much about using vision in a receptive way, how we receive information. And so, one of the things that we can practice is to learn how to look soft, because it actually lets us let go of tension. So, as an analogy, actually, how we use our eyes to look for details, you often may point your pointer finger to things that you are looking at or looking for. It's like they are sort of paired neurologically. So if you're at home, you can try this. Take a pen and use just the index finger and the thumb, and you're holding at hold the top of the pen. Just kind of press your fingers so that almost like they're going to go white, but lots and lots of pressure. You may notice this is like looking hard. We call this looking hard. It's effortful pressure that you're putting on the pen. It's effortful looking, and you may even notice the peripheral vision tends to tunnel in when you do this. Now, allow yourself to release the pen tension and hold it more gently, almost like it's going to slip from your fingers if you let go anymore. This is what it feels like to look soft, to just let your eyes rest on a target, to let yourself receive information. You can see things just as clearly with less effort around the eye muscles, and that lets go of some of the tension that we tend to hold for people who are very tense. They may feel like their brows get tense when they strain and look at things. These tensions carry over through the whole head, the neck, the back. So learning to look soft actually helps a person learn that the tiny little muscles that change our focus inside the eye, they do the job without you putting all the extra big muscles involved in holding the head and the facial muscles. You don't need them. Look soft. It teaches you to release. Another one that I like to give, which is a quick and easy tip, is called the 20-20-20 rule. So for every 20 minutes, worth of reading or near point work, take 20 seconds and look at least 20 feet away. You're going to try to make sure you keep something clear for that full 20 seconds. So that means, let's say you sit by a window at your job and you've been working on the computer for a period of time. You want to allow yourself after about 20 minutes to look out the window and see something. No, don't just look and let it be blurry. Get it back to clear. The natural use of the visual system is flexibility and learning how to see far and let that be clear. If we hold too much tension for too long at near, our eyes focus, our eyes converge, our body may actually also tend to curve inwards. We put effort on our body and strain on our system that we're not designed to do for long periods of time. So you need to be able to take that also with breaks by taking visual breaks to look far. And that also helps with head writing. It helps remind you to ease the posture in your back and learn how to just learn to let go more quickly. So at first, 20 seconds may take you 20 seconds just to get to the point of clearing something up. As you get more facile with it, you should be able to shift your gaze more quickly. There's one more that I think would be a useful thing. As I mentioned a few times, keeping the head upright, not tilting the head one way or the other, actually takes a load off of the visual process and the visual input system, because the eyes are designed to be binocular when the head is upright. So one thing you can do is you can get a slant board for any sort of surface that you're reading on. Like if you have a tablet, don't just put it in your lap and let your head hang down in front of it. You want to bring it up so there's a little bit of an easel to it. A slant board should be around 25 degrees, maybe 22 degrees. If you have a book, notice that if I'm looking at the bottom of the book, it's closer to me and the top of the book is further from me. If a book is flat, that is the case, even if I lower it. But if I use a slant board, the top of the book, which is farther, becomes closer. The bottom of the book, which is closer, becomes farther. And at an appropriate reading distance, it becomes more regular as a distance. So my eyes don't have to keep changing focus. And I don't have to bend my head quite so far down in front of my body, bringing my posture forward. I can allow my eyes to gently gaze down. Most of my head weight stays above the core instead of tilting in front. And this is a really helpful way to alleviate that tendency to get too close to things. And it has such negative effects all the way through the body.
Thank you very much, Samantha. We really appreciate it. It was so wonderful to have you on the channel.
Thank you. Thank you so much for inviting me. It's a pleasure to speak with you, and I hope your audience becomes a little more open-eyed to the idea of a functional use of our vision, and that those of us who do this work can really help put your body back into balance, not just your sight and clarity clear and in focus.
Thank you.